So welcome back everybody to our channel. We have got our final one for this year, 2025. Yes. So we've got another interesting topic today. We're going to be talking about the use of photographs in plastic surgery and how people use them to help make a decision, amongst other things. My name is Dhalia Masud. I'm a plastic and reconstructive surgeon.
I'm Rachel.
I'm Hayley. Great, fantastic. So we get asked this question a lot about, do you have any photographs of pre-op patients? Outside this, what are your thoughts about looking at or using photographs to decide on what kind of surgery?
I think that is the usual first step for anyone when they're thinking about things. I would find it useful, definitely. Yeah, would you?
I would. Yeah, I think sometimes when you search online though, there are a lot of AI images which you're best to try and surgically find the photo.
I think we get, I know we get a lot of requests about photographs. And I understand how using photographs is really important to help making a decision. My only concern is the use of AI and the manipulation of photographs when you do look up photographs on Instagram and other people are looking. But also every patient is different, patient's body shape is different. So you see these after results and that patient has the photographed patient has a very different body shape, medical history to the patient that is looking and trying to make a decision. So they are thinking, okay, I want a result like that, and I'm going to get a result like that if I go to that particular doctor. But that's not going to happen because their body shape can be completely different, and that's what concerns me.
So it can be detrimental to the process, then you think?
Yeah. If patients use it to get an idea of what the potential outcomes is, that's fine. But if patients use it to say, yes, that's what I want, that's when it becomes really difficult. And judging photographs, like you say, with AI, the manipulation with AI is also quite dangerous. So that's my main concern. And the other thing is, if I had a daughter or if any of my close friends or family were having surgery, and doctors or people are putting photographs of themselves, or doctors are putting photographs of themselves on the internet, they could always be taken and manipulated and used for malicious purposes. And that's a very modern day thing now.
Yes.
So
it is a recent thing, as you say, isn't it? I know you're saying like AI, I guess even before that it was Photoshop. It is difficult if it gives people a false sense of what can be achieved. As you say, then the misuse of material. What is the answer?
I think the answer, what other options do we have, do you think?
Well, we don't put their faces on.
So you do show examples, don't you, in a consultation, so then you are avoiding the misuse of content. And it is real surgical results, isn't it?
I think the best way to avoid issues like that is to go and see the consultants themselves and look at the photographs that they have in front of them in a real-time way and have a discussion. I know it can be costly because it means having to pay for a consultation, but you do have that peace of mind with the connection with the surgeon, but peace of mind that you know that that surgeon did that operation.
That was your actual surgery.
Yeah, and then for me, I know that I can show them pictures of patients that look similar to them.
I was going to say that you always work out, you know, and you're quite honest, you're not going to look like this person, but let me find somebody that you are going to look like, or similar shapes, because everybody's body is completely different, and I think sometimes you don't want people to be disappointed with the outcome.
But you have to be prepared to pay a consultation fee, which then includes the photographs. You're not going to go ahead with anything without a consultation and paying a consultation fee anyway, are you?
No, but then I think that's good that you are, if you really want to have it done, then it's a yes or no then, isn't it? Kind of gives you that indication of whether you actually do want to have it done or not.
But what you're saying is people are basing, they want to see photos, they'll request that first, because that's going to be help them make the decision if they even come for a consultation. That's what you're saying, isn't it?
So, and before photographs, or before the use of Instagram and the free use of photographs, people had to book consultations. They had no choice. And then photographs came along, and it was an easy way to have an idea of what the surgeon can do. It was a free way.
Yeah. But it's good because it shows the portfolio of the surgeon. I mean, if you're going to spend all that money, I would want to see what you've actually done, because you don't
You could see the portfolio in the consultation, but you'd have to spend money.
Yeah, but I think if you really want to have surgery, that consultation is worth doing, because you're going to see it. And I think it's really important, you know, especially like with breasts and things like that, to see how you are going to look. You know, a day after the surgery, a week after the surgery, so you get a really clear indication of how it's going to look.
That's true, actually. Yeah, because even in those galleries where people have made this material available, that purely is a before and a healed after.
And I think it's really good to see the rawness of it, because if you had something done and you didn't know what's going to, that would freak me out a bit.
Would it? The
Yeah,
initial
massively. Yeah. Because it is a lot, isn't it, when you're doing stuff? Some procedures are a lot, and it is just to, you know, expectations, isn't it? You know what's going to come. You're not going to worry so much.
For you personally, seeing the immediate post-op results, you know, after taking the dressings down, and I showed photographs of what it looks like on that week one when it's bruised and they've got that raw wound, etc., raw scar. Do you think that will put you off?
I mean, we all know that. Surgery does took me off anyway, but that's because at the moment I feel okay. It's not to say later on, but I think it's really good to know what you're walking into. So I think it is good. I wouldn't say it puts me off, because actually if I had fake boobs and I wanted them removed, it wouldn't bother me, because health is important, isn't it? But
I think it's a reality check.
It is a
of
reality
the
check.
enormity of what you're actually considering, where with just the purely the before and the healed after, you're really not getting the whole picture. So
no,
as gruesome, well, not gruesome, but you know that it's.
I think having implants and having implants removed are two different entities, aren't they? There's a lot of reconstructive work that can happen when you have your breasts taken out. And you see that when you show them the picture. I mean, I've seen it, and it is, you know, it's not heartbreaking, but obviously you kind of, it's a lot, considering when you have the boobs in, you kind of walk out and then there's just a little bit of a, you know, a little bit of a cut and some scarring, but equally, it's really good to see that within a few weeks, they look great. You know, it goes, that initial thing goes, but I think it's really important. And you are really good, because you do show them, you know, this is what it's going to look like. And most people go, oh my God.
Are you, knowing what you know what's happening with AI, or people lifting photographs and using it for malicious purposes, whether it be porn, whether it be something else, particularly when you're dealing with sensitive parts of your body?
I think we do have to think more carefully.
You do have to
it's changed things, hasn't it?
People want the photographs on the Instagram, but
I think that's when you need to see a consultant.
Yeah.
You don't need to be doing that personally. You can see a lot of this stuff. It wouldn't be something that I would be happy about, no.
Yeah, because more and more, there is a massive demand of seeing photographs on the Instagram pre-op, but people don't consider the safety of those individuals that are going on in the Instagram. So it's really difficult to balance that amount of information out there, but protect the individual patients and give. So apart from a consultation, what other ways can we think of to help patients?
I don't think there is.
No.
I think the best thing is to have a consultation, because then you're actually speaking to an expert. You're not, you know.
I think you're doing what is the best. Show them the real examples. Obviously, as you said, everything within our own clinic software is all data protected. That's not being released anywhere.
The internet is a funny place, isn't it? I mean, you have a symptom, you type it into Google and it tells you you've got X, Y, and Z, but actually we don't know, we're not, you know, you need to see a specialist.
Yeah, it's a difficult one.
It's difficult.
And I've never seen any photos of post-op, the rawness of it. I've not seen those on the internet.
No, people don't like to put those on.
No, But realistically, they're the ones that you'd want to see out of
Yeah.
everything, because that's what you're dealing with.
Yeah, and the infections and the things that potentially.
And things that to look out for, that you always say.
That's a good one, things that you need to look out for.
Yeah, and prevention, like when you do certain things, you put in prevention to stop
Yeah.
anything happening. You just need to find a surgeon that you really trust. I
Yeah.
think that's really key.
That is the thing, but usually the photo request comes in as part of them forming an opinion of the surgeon they're going to really trust. It's a bit of a goes round in a circle, doesn't it?
Yeah, I think nowadays we all have to be super, super careful with photographs of patients, even ourselves. You know, have to question what people do with all that information out there. You'd have to, I would recommend making an appointment.
Yeah.
This is where it's important to look. The information that is safe is making sure that the surgeon you go to is board certified, GMC registered, is on the specialist register. At least that is the most important thing. And when you go and see them, request the photographs and they'll show you the photographs. And rather than start off with what they look like, what the patients look like, start off with what kind of surgeon are you going to go for? Are they actually qualified? And then go and see them before. That's what I would recommend.
And you have to gel with your surgeon.
Yeah.
If you walk in somewhere and it doesn't feel right, then it's probably not the right one for you.
Great. Well, thank you very much for your time, and hopefully we'll see you in the next one.
Yeah.
Bye.